Hi folks, I'm Laird Landon. I hope you've just watched the video on palliative care, because we're going to talk now on how caregivers actually deliver palliative care. This isn't just something healthcare system needs to address. This, in fact, is the essence of what we do. And I want to talk about what the motto is for the Caregiver Support Foundation. And I hope you'll be more interested in the foundation and the things it offers and the things you can do to help us. The motto is, keep your loved one safe and comfortable and create moments of joy. That's it. Keep them safe. This often comes up with driving, with taking a walk and getting lost. We need to make sure we're paying attention to them all the time, or someone is, so that they don't hurt themselves. We want to be careful about throw rugs in the home where they can trip. We want to be careful about the stove so we don't leave it on, or they don't leave it on, and burn the house down. I know one caregiver that decided it was time to place his wife because he came home one day and found her nibbling on mouse poison. He said, that's it. Safety is very important. Having an occupational therapist come in and evaluate your home for safety hazards and teach you the proper way to do some of the things you need to do is a very good way to keep your loved ones safe. The second one is comfort. Now, we often mess this one up because we mix our own goals in with keeping them comfortable. For example, I've heard caregivers say in support group, I just see my husband lounging around watching TV. As a matter of fact, I've seen him watching the same show over and over again. And I want to get him up out of the chair, taking a walk, so he'll build his strength and he'll be able to live longer. Well, you've messed up on a couple of points if you try that. First of all, it won't help him live longer. And second, he isn't having any fun when you're nagging him to go for a walk. If he's happy sitting in the chair watching TV, think before you interrupt that to do something you think is better for him. Moments of joy. This is my favorite because when I look back on my journey as a caregiver, this is the thing I wish I had done more of. I remember the thing I cared most about in the entire journey. We celebrated our 50th wedding anniversary when Marilyn was in memory care. Never mind, we had planned to do a cruise on our 50th anniversary. That couldn't happen. But I went all out on the anniversary party in memory care. Imagine this, a sheet cake in the middle of the room. I brought the hat she wore in her wedding. The veil that attached to it is long since gone, but the little kind of pillbox hat she had, she loved it when I pinned it in her hair. I brought her the wedding album, and I looked through all the pages with her, and she loved it. She clutched it the entire party and showed everyone else in the room. She had a great time, and I remember that. I created that happiness for her, and I'm proud of it. I also found all the people working in memory care had a good time at the party too. There are some of them I had never seen smile. You might even keep a journal, a separate journal, not on what you do every day, but just on the special days when you create a moment of joy. There's something else really important about that. You are probably the most able to create moments of joy of anybody because you're closest to them. because you have a memory of those experiences you lived together, because you remember the people. You can delegate comfort and safety to some extent. When we place someone, we're saying the demands for safety and comfort are greater than I can provide at home. And it makes us feel bad because we aren't doing the job. But moments of joy, you can do better than anyone. So that's the motto. Keep them safe, keep them comfortable, create moments of joy. But I want to call your attention to what is not in that motto. It does not say you should spend your time searching for a cure. It does not say you should try every over-the-counter drug you can to improve their memory. It says that when you do that, you're taking your focus away from safety, comfort, and moments of joy. This comes up often with respect to the FDA-approved drugs for people with dementia. These drugs may provide short-term behavioral improvement. They do not reduce the speed of the disease as it affects your loved one. Doctors are actually reluctant to prescribe them. I've talked with some neurologists who have told me if they had a loved one, they would not prescribe these drugs. I said, well, why do you do it then? Because the family wants to try everything they can that might work. In my experience as a non-professional, every caregiver in a support group I've worked with that has tried some of the FDA-approved drugs within 9 months was not using them, either because they did not notice any difference or because there were some side effects that made caregiving even harder. So please, if you're talking to a doctor about medication or anybody about rehab or some other intervention, ask them if they think it will really help, if it will really work, if it is really worth making them uncomfortable. I hope this works for you. Create safety, create comfort, and create moments of joy. Check out our website if you want to learn more about the foundation and what we do. Caregiver Support Foundation. The web address is family-caregiver.org. Thank you.